Okay, let's dive into something that, frankly, sounds pretty terrifying.
Yeah, the whole flesh-eating bacteria thing you hear about in the news sometimes.
Exactly that. Though, the media term is dramatic, the medical reality behind it is incredibly serious. We're talking about rapidly moving infections in the soft tissues.
Properly called necrotizing soft tissue infections, or NSTIs.
Right. And what immediately jumps out from the material we looked at is just how fast these things move.
Uh-huh. It's shocking, really. The sources describe how quickly they can destroy muscle, fat, skin. It's not a slow burn at all.
No, it's like a wildfire just raging beneath the
And
surface.
that's a good way to put it.
So for you listening, maybe you're just curious, maybe you or someone you know has been affected or you're a caregiver, this deep dive is really for you.
We're trying to pull the key insights straight from the sources, sort of cut through the fear.
Yeah, understand what these infections actually are, what makes them so aggressive, who's most at risk.
And how doctors spot them, and crucially, how they fight back.
And they're rare, right? The sources mention numbers.
Yeah, relatively rare, maybe around 4 cases per 100,000 people in developed countries, something like that.
But the impact when they do happen, it's huge.
Oh, definitely. The mortality rates mentioned, they can be really high, sometimes 20%, maybe even higher, depending on the situation. It's serious stuff.
So what is it about these infections that makes them so destructive? The sources kind of pointed to a perfect storm scenario.
Right. It seems the infection itself basically suffocates the tissue. It creates this environment where oxygen just can't get in properly.
A low oxygen environment, hypoxia.
Exactly. And that low oxygen state is precisely what certain very aggressive bacteria absolutely love.
So they thrive, and that leads to incredibly fast tissue death and massive inflammation.
That's the destructive cycle, yeah.
Mhm.
And it's often not just one bad actor, bacterium-wise.
Okay. So not just the infamous group A strep that the media focuses on.
Well, that one is often involved, the classic flesh-eating bug. But the sources were clear that, more often than not, these are polymicrobial.
Meaning multiple types of bacteria all working together?
Yeah. You see different types of streptococcus, Staphylococcus aureus is common, and importantly, anaerobic bacteria like Clostridium.
Anaerobic meaning they like those low oxygen conditions we just talked about.
Precisely, they flourish there.
Okay, so who's most likely to face this kind of infection? What are the risk factors?
Well, the most common trigger, maybe surprisingly, is often just a break in the skin.
Really? Like even a small cut?
Yeah, it could be a small cut, a scrape, an insect bite, a burn,
Yeah.
or bigger things like surgical wounds or, significant trauma,
So an entry point.
an entry point. And then underlying health conditions play a really big role in vulnerability.
Like what? What did the sources flag?
Diabetes is mentioned prominently, a major risk factor.
Okay.
Also obesity, heavy alcohol use, smoking. Yeah. Basically anything that weakens the immune system makes someone more susceptible.
And recent surgery too, you said,
Definitely. That came up as a key point in the material.
which leads to a really critical challenge, right? Spotting it early enough.
Huge challenge. The sources really stress the need for high clinical suspicion. Because early on, the skin might not look that bad.
Just some redness or swelling, like a more common infection maybe.
Exactly. It can be deceptive. But the absolute crucial red flag, the thing everyone needs to know, is pain that feels completely out of proportion to how the skin looks.
Pain out of proportion. That seems vital.
It is, often described as excruciating pain, even when the skin changes seem minor. That's a massive warning sign.
And then you might start seeing more obvious signs later on.
Right. As it progresses, the skin might turn a dusky color, or you might see blisters, even black areas where the tissue has died. Numbness can happen too, as nerves get damaged.
How is it definitively diagnosed then? Is it just clinical suspicion?
Often, the true extent is only seen when a surgeon actually operates. They find the damage is much deeper and wider than it looked on the surface. Though imaging, like CT scans, can sometimes help beforehand by showing deep tissue involvement or gas under the skin.
Wow. Okay, so given how fast and severe this is, how do doctors fight it? What did the sources say?
It has to be an aggressive, multi-pronged attack. The absolute cornerstone, mentioned again and again, is rapid surgical debridement.
Debridement, meaning cutting away tissue?
Yes, removing all the infected and dead tissue as quickly as possible. Antibiotics are vital too, of course, to kill the bacteria.
But the surgery is key because antibiotics can't really get into dead tissue effectively.
Exactly right. That's why surgery is paramount. And you need a really skilled multidisciplinary team surgeons, infectious disease docs, critical care. because these patients can become incredibly sick very quickly.
The sources also talked about other therapies, didn't they? Like hyperbaric oxygen.
Hyperbaric oxygen therapy, breathing pure oxygen in a pressurized chamber.
Is that instead of surgery?
No, definitely not. The sources were clear. It's adjunctive, meaning it's used in addition to surgery and antibiotics, never as a replacement.
Okay. And the idea behind it?
Well, the thinking is it helps force oxygen into those damaged low oxygen tissues. It might help slow the infection spread and maybe even make the antibiotics work a bit better.
Does it definitely work? What did the literature say?
That's where it gets a bit debated. Getting large-scale definitive proof of a mortality benefit is tough with conditions like this. Some studies suggest it might help, maybe reduce amputations or improve outcomes in the very sickest patients, especially if started very early.
So a potential tool in the toolbox used alongside the main treatments.
Pretty much. Usually involves treatments like twice a day for the first few days if it's used.
Okay, so let's try and wrap this up then. Key takeaways from this deep dive. Necrotizing soft tissue infections, NSTIs, they're rare, but they move with terrifying speed.
Literally destroying tissue very, very quickly.
And early recognition is absolutely vital, especially looking for that classic sign.
Pain. Pain that is far, far worse than what the skin changes might suggest. That's the big one.
Then rapid surgery debridement plus strong antibiotics and expert team care are the core of the treatment.
Right, with potential support from adjunctive therapies like hyperbaric oxygen in some cases.
So what for you listening is really understanding those risk factors we talked about: diabetes, recent trauma or surgery, weakened immunity.
Yeah, knowing those and knowing how incredibly fast these infections can move, it just underlines why getting medical help immediately is so crucial if you have concerning symptoms.
Especially that disproportionate pain. Don't wait. Don't try and tough it out if something feels drastically wrong.
Absolutely. Don't delay.
And thinking about this whole picture, the infection creating its own low oxygen environment, the speed of tissue death, the body's massive inflammatory response.
Yeah, it's quite something. It really highlights how quickly infections can potentially overwhelm the body's defenses.
It makes you appreciate why tackling something so fast and destructive needs that immediate, aggressive, coordinated medical response we discussed. Surgery, antibiotics, the whole team effort.
It's a stark reminder, isn't it, of both how vulnerable we can be, but also the power of medicine when it's deployed rapidly and effectively against something this aggressive. Time is everything.